Hi, I'm Dr. Chad Larson. I do a lot of micronutrient testing. The micronutrients are the vitamins and minerals and amino acids. To contrast that with macronutrients, micronutrients are the vitamins and minerals, and macronutrients are the fats, carbohydrates, and proteins. So I wanted to mention some things about micronutrients and micronutrient testing. I find it really valuable. It really helps to take out a lot of guesswork about what nutrients a person might be deficient in, and it's a way to really develop a targeted nutritional supplement protocol, or to help explain to the patient which foods would be most important for them based on certain nutrients, so they could boost those levels up. So I've talked before about most of the fat-soluble vitamins. So most of the vitamins that we think about are water-soluble. Things like vitamin C and the B vitamins are water-soluble, but there's four main fat-soluble vitamins: vitamins A, D, E, and K. I've talked a lot about vitamin D. I haven't talked much about vitamin E. I don't find that one as deficient. Vitamin D I find frequently deficient. Vitamin A, kind of medium. Certainly find that relatively frequently, but I find vitamin K to be deficient very, very frequently. And there's two main types of vitamin K. There's vitamin K1 and vitamin K2, and I find them both deficient all the time. So I want to spend a little time and talk to you about vitamin K and why we maybe become deficient, and what we can do to help fix that deficiency, and why that's important for your health, more importantly. So vitamin K is a nutrient. Like I said, it's a fat-soluble nutrient, and it's involved in multiple organ systems, mostly your bones, your brain, your heart, and your gastrointestinal tract. And the main effect, or the main sort of association with the gastrointestinal tract, and this is where vitamin K is sort of metabolized and absorbed and assimilated, and it really depends on the health of your gut microbiome. Remember, your gut microbiome is the combination of all the bacteria in your gut, and there's a broad variety of bacteria that live in the gut, 2 to 3 pounds of bacteria. It's a very important balance of bacteria, but for a variety of reasons it can become imbalanced. Probably the most common reason is poor food choices. Certain foods, kind of the standard American crappy diet. I call it garbage, basically garbage, carbohydrates, all the sugars and refined processed foods and stuff. This really starts to mess with your gut microbiome, and that could really influence your ability to assimilate and utilize vitamin K. So it's probably the top reason why so many people are deficient in vitamin K. But there's some other common reasons are that people just aren't really getting it in their diet. You can get a lot of vitamin K, especially K1, in the dark leafy vegetables, the dark green leafy vegetables. Things like your kale and spinach and these kind of things are high in vitamin K, and oftentimes people just aren't eating enough of these to get the vitamin K. But then if you compound that with they have an unhealthy gut because their gut microbiome is not balanced, we call that dysbiosis. If they have dysbiosis, that's going to influence their body's ability to assimilate and absorb the vitamin K. This also goes with vitamin K2, but vitamin K2 we find mostly in like animal proteins. Certain types of like raw yogurt and animal proteins like beef and fish and these kind of things have vitamin K2, and they're both really important. They have both K1 and K2, but generally they're helpful for the bones. We've talked about in the past the need for vitamin D for the bones. A lot of people think that osteoporosis or even osteopenia, kind of the step before osteoporosis, is a calcium deficiency condition. And I've discussed in past episodes that that's not totally accurate. It's more that calcium is just in the wrong place. And vitamin D is kind of the quarterback, the gatekeeper that sort of controls where calcium is going. But I'm going to explain in just a moment the important influence that vitamin K has. So vitamin D is really, really key for bone health. But vitamin K, just the way I kind of explain it to patients is vitamin D tells the calcium where to go, and then the vitamin K is sort of the glue that sticks it in the bone. Of course, that's not actually how it's happening, but just to give kind of a visual of the importance of these key nutrients, that's kind of the way that I generally sort of explain it. But vitamin K is important for sort of the structural matrix of the bone, and also it tells the calcium to stay in the bone. That's kind of what I mean by the glue component, because calcium is just going to go where it's told to go. And if you don't have enough vitamin K, then that's going to possibly lead to calcium hanging out in your blood vessels, like your arteries. You know, there's a really good kind of cardiovascular evaluation called a calcium score, and this is a way of measuring calcium in the arteries, and we could sort of literally quantify the degree of calcium buildup, which is not good for those blood vessels. That sort of narrows the passageway of blood flow through these really important arteries. And oftentimes this is because we have a deficiency of vitamin K. So this is one of the reasons why we need vitamin K, is to help with the cardiovascular system. So we talked about the cardiovascular system, allowing the vitamin K kind of helps to prevent calcium buildup in the blood vessels. It also helps to promote more calcium to stay in the bones. So cardiovascular, and we talked about bone health. It's also really key for the brain. I mean, if for only the reason that blood flow is so key for the brain, if the coronary arteries, the carotid arteries don't have proper blood flow, those are the main arteries that bring blood to the brain. So if there's any kind of issue with calcium buildup in those blood vessels, that's going to influence the ability for the blood to flow in an optimal way up to the brain. But also, we know that vitamin K is really important for the structural integrity of the blood vessels. So people who bruise more easily, and I hear this all the time, I feel like I'm bruising more easily. I test them and their vitamin K is almost always low. So it's one of those nutrients that we really need for structural integrity of things, your blood vessels, your bones. And so vitamin K is kind of an unsung hero when it comes to the fat-soluble vitamins. Most people think about vitamin A and vitamin D and vitamin E, but there's not enough emphasis discussing vitamin K. So there's K1 and K2. Some of those deficiency signs that I mentioned, just to reiterate, is imbalance of the gastrointestinal tract, GI type symptoms, gas, bloating, bowel movement changes, abdominal discomfort. These kind of things could be telling you that you have a risk for vitamin K deficiency. Easy bruising, bleeding in the gastrointestinal tract, that can also be a sign, because vitamin K is involved in proper clotting. So if we bump our arm or our leg into like a table corner and we get like a huge hematoma, that oftentimes is a sign of a vitamin K deficiency, because what's supposed to happen when we bonk into something and it kind of pops a little bit of a blood vessel, that blood vessel is supposed to coagulate, and vitamin K is really key for proper coagulation. And in fact, that's why certain medications actually target vitamin K as an anticoagulant. That's a whole other story that I won't bore you with right now, but people who are taking these blood thinning medications realize that, and they get certain tests done to make sure that they're not throwing off that balance by actually consuming too much vitamin K. So vitamin K is super key nutrient. It's one of the key fat-soluble vitamins. So, I always evaluate it because I like to take the guesswork out, and I don't want to just put every nutrient, have everybody take every nutrient. I think it's key to really make it targeted and kind of specialized and individualized. So vitamin K is one of those things that I definitely put on the list to have your doctor evaluate. And it can help with all these organ systems, your brain, your cardiovascular tract, your cardiovascular system, your GI tract, your brain, and your bones. So super key. Hope you learned something. I will keep reading the studies and bringing you the information. Until then, keep it real.